Good morning, everyone, and welcome to Webinar Wednesdays with SMP. We're really glad to have you all here with us this morning. My name is Sunny Lawless, and I'm the volunteer coordinator for our SMP programs. I'm going to be your host for this morning. Presenting for us today is Jose Pinto, who is one of our community outreach specialists in Georgia, and Danielle Guillory, who is a community outreach specialist for us in Mississippi. Today we're going to, for the July installment of Webinar Wednesdays, we're going to talk about durable medical equipment fraud and scams, or DME for short. During the presentation, you're welcome to type in any questions that you might have into the chat, but we're going to hold all of those until the end of the presentation when we'll open it up for question and answer. There's also going to be a prize drawing at the end of the presentation today. You must have been registered to attend the webinar prior to 10:15 a.m. this morning, and you must be present to win. Before we get started, I do have to let you know that this project is supported by the Administration for Community Living, Department of Health and Human Services, as part of a financial assistance award with 100% funding by ACL HHS. The contents are those of the authors and do not necessarily represent the official views of, nor are an endorsement of, or by ACL HHS or the U.S. government. So who is Senior Medicare Patrol? Well, if this is your first time joining us for a webinar, SMPs are grant-funded projects of the federal U.S. Department of Health and Human Services and the Administration for Community Living. All SMP grantees have a shared national identity through a national program name and logo. Every state has an SMP program. In Georgia, Louisiana, and in Mississippi, SMP is sponsored by AdviseWell. And our mission, or the mission of SMP, is to empower and assist Medicare beneficiaries, their families and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse. And we do that through outreach, counseling, and education. And last year we celebrated the 25th anniversary of the SMP program. Now, before I turn things over to Jose, we do have a quick polling question for you. Today's polling question is, have you ever received a phone call from someone offering you a free back or knee brace? If you'll give me just 1 second, I'm going to launch that poll and you can let us know yes or no. Have you ever received a phone call from someone offering you a free back or knee brace? And I'll give y'all just a few seconds to answer. Okay, just a couple more seconds. We're getting closer to that 100% voting. All right. Well, it looks like, let's see, I'm going to share these results with you. So it looks like 71% of you are lucky. You've never received that phone call from someone offering a free back brace or knee brace, and 29% said yes. So we're going to turn things over to Jose, who's going to go over what is durable medical equipment. He's going to let you know what it is and how fraudsters use it to scam Medicare and scam you guys. So Jose, I'm going to turn things over to you now.
Yes, ma'am. Thank you very much, Sunny. First, guys, let's talk about what is DME. Durable medical equipment, or DME, is medical equipment and supplies prescribed to you by your doctor that is reusable and has a usable life of at least 3 years. It's usually equipment mainly used in the home and for a medical reason. Examples of this type of equipment are back and knee braces, which I'm glad you guys aren't getting many calls about anymore. It used to be a major problem. Walkers, wheelchairs, hospital beds, home oxygen equipment, diabetic supplies, therapeutic shoes, and scooters, among other things. To qualify for DME, you will need a prescription from your doctor. So if you need durable medical equipment, you and your doctor can make that decision. They know your health needs and can prescribe DME when medically necessary. Some equipment must be sized so it'll work best for you and fit into your home. Remember that, guys. Any type of wheelchair, walker, even some canes, you need to make sure that it fits in your home. You have ramps, your carpet is tacked down, that it's safe and secure to use in your home. That's something that your general practitioner can help prescribe a legitimate company that will help come out and make sure your home is ready for that. That's really important. A lot of people get a wheelchair and they think that it just works in their home, especially homes made before the 80s, they're 1980s, are notorious for being hard to maneuver medical equipment around. Medicare only covers DME or durable medical equipment if you get it from a supplier enrolled in the Medicare program. I can't stress enough, guys, how important it is to make sure that you get a prescription from your general practitioner. For those of you that are in rural areas where it's more difficult to find a doctor or find a geriatric specialist or someone you trust, or there may be one in the entire county that serves a large population, it may be hard to talk to them if you've had problems with them in the past. But it's important that you make that effort to try and make sure if you need durable medical equipment that you go through that general practitioner. Do not try and rely on someone that's going to be calling you or someone that's responding to a mailer or responding to any type of TV commercial. Just be very clear on that. For those of you in the urban or largely populated areas, I know it's easier for you to maybe change to a different general practitioner or geriatric specialist, and it may be easier for you to maneuver the system and get what you need. But for those of you that can't, please try and work through that general practitioner. They have your best interest at heart. Next slide, please. Now that you know what DME is, let's talk about DME fraud and scams. This type of fraud and scams have been on the rise. Many people are getting calls from suppliers offering free equipment, or they're getting supplies in the mail without having ordered any supplies or equipment. Examples of DME fraud include billing for equipment that you never received. You provide your Medicare number to the DME provider, they bill Medicare for the items, and you never receive anything. That's why it's important for everyone to, and Danielle will go over this later about going over your explanation of benefits, okay? Make sure you know what you're paying for, know what you're getting, and know what you're being charged for. Billing for equipment different than what you've received. The provider offers to send one thing, they bill Medicare for it, and you receive something totally different. Often, the provider will send multiple braces for different uses. Billing for equipment you do not need, and giving false or misleading information, such as offering free equipment when they are going to bill Medicare. The provider tells you the equipment is free, however, they bill Medicare anyways. Guys, remember, nothing is free. Be careful of terms like approved by, sponsored by, tested by, recommended by. Remember, Medicare is a federal program and they're not allowed to approve, sponsor, test any merchandise or products, or recommend. So if you hear that language when someone is talking to you, especially about durable medical equipment, vitamins, or anything, take it with a grain of salt and be very clear that this may be the beginning of fraudulent activity. Next slide, please. Some potential DME scams that lead to fraud. Getting calls or visits from people saying they represent Medicare and trying to sell you products. Go back to that again. Remember, guys, no one represents Medicare that will sell you something. All right, just doesn't happen. Many television and radio ads run targeting beneficiaries to get them to order free DME. These ads don't have the beneficiary's best interest at heart, so don't fall for the advertising of free equipment. I know lately I got rid of my cable television and I have been getting free television from the air. I know that's a novel idea for a lot of younger people. They don't know anything other than cable, but I get a lot of free television from my antenna. And I've been watching a lot of old TV shows, and they bring back a lot of memories. And I don't know how many people here know Rockford Files. Anyone? All right. How about Three's Company? Well, anyways, I've been watching a lot of Rockford File and Three's Company, and during the programming, I see a ton of these commercials, tons of them. And guys, most of these commercials, as we said, do not have your best interest at heart. All right, do not fall for these commercials. If you see something that interests you, write down what it is or what type of device, and call your general practitioner or geriatric specialist for a appointment, and then discuss it with him or her to see if it's something you need or something that would benefit your health. Aggressive marketing by durable medical equipment suppliers. Don't let anyone persuade you or pressure you into switching suppliers. Talk to your supplier first, because you may not need to make the change. Guys, always talk to the supplier. And once again, I tell everyone that I talk to about this, follow up with your general practitioner. Make sure that that general practitioner is aware of what's going on and who is trying to sell you something. All right. Usually that first durable medical equipment supplier that you're dealing with that was referred to you by your general practitioner can sometimes, you feel better about it. I don't want to say fully trusted, but you feel better about them. But of course, we have trouble with a lot of people that provide us consumer goods. So feel free to switch, but make sure you approve it with your general practitioner. Seniors across the United States are receiving calls from people offering them free back braces and knee braces. They ask for the senior's Medicare number, date of birth, and other personal information. In some cases, the senior never receives the equipment, but Medicare is billed anyway. Sometimes the senior receives the equipment, but it does not fit properly, so they are unable to use it and have trouble returning it to the provider. So Medicare ends up paying for the equipment they are unable to use. Guys, that's really big with this scam, especially with knee braces and back braces. If you go to your general practitioner and ask, and they feel that you need this knee brace or back brace, you can go to an orthopedic and get one custom fit. That's something you can do. Relying on someone from television or someone from a mailer or direct mailer to provide you with that type of information or that type of service can be a huge red flag, and a lot of times it's the beginning of a fraudulent scam. Next slide, please. Great. This graphic, produced by the Office of Inspector General, OIG, shows you an example of how the scam usually works. So I'll give you guys a second to take a look at it. And these pictographs are excellent, or infographics are excellent. Take a picture with it with your phone. All right, it starts with the conspirators. They own the call centers where telemarketers call beneficiaries directly, and they offer free or low-cost orthotic braces. All right, there's your first step. The call center confirms that the beneficiaries are on Medicare and then transfer them to a telemedicine firm for a doctor's consultation. All right, so we've gone from conspirator, they're in the call center, they're trying to get your information. Call centers take your information. Doctors and telemedicine company will then do a consultation. The doctor and telemedicine company prescribe an orthotic brace, regardless of medical necessity. They then turn around and submit the brace prescription to the call center. The call center collects the prescription and sells them to a medical equipment company. After the medical equipment company buys the prescription, the medical equipment company sends the knee brace or multiple braces to the beneficiaries. The company bills Medicare and pays a kickback to the conspirators. Then the cycle starts all over again. Guys, I don't know about you, but that's a lot of steps just to get an e-brace, when it would be simple just to go to your general practitioner and try and get a referral to an orthopedic in your own town. A lot of these guys are not in the same town you are. They live somewhere else in the country or somewhere else probably in the world. So it's better that you deal directly with people that you have face-to-face interaction with. All right, next, please. All right, wheelchair scams are another very common type of durable medical equipment, or DME fraud. Mechanical and motorized wheelchairs can assist the beneficiary who has a chronic ailment or disability that prevents them from freely ambulating. The power wheelchair industry has grown into an almost $1 billion per year industry. You've probably seen commercials on TV offering wheelchairs at little or no cost to you. Be aware, the Medicare rules stipulate that you must have a legitimate need before obtaining these devices, and a certificate of medical necessity must be signed by your doctor. Let's go over that just one more time, guys, because this is huge. You've probably seen commercials on TV offering wheelchairs at little or no cost to you. Be aware The Medicare rules stipulate that you must have a legitimate need before obtaining these devices, and a certificate of medical necessity must be signed by your doctor. All right, guys, how the scam works. All right, DME street scammers may approach you to offer a power wheelchair that is a free benefit. All right, knock on your door, approach you in a shopping center, CVS, Walgreens, and it may be a free benefit for having Medicare. This is not the case. The beneficiary must have a legitimate need, copays and/or deductibles may have to be met, and the physician prescribing the device must have examined the patient. The cost of these power devices runs from $1,500 to $6,000, I'm sure more, depending upon the model. In addition, accessories may be ordered that are not needed, driving the cost up higher by several $1,000s. We all know the scams at the car dealerships, the undercoating. We all know that the film on the window to block the sun. All of these things can be scams at car dealerships. Realize that when you're buying a wheelchair, the same thing happens. Often a scam artist will contact the beneficiary and use scare tactics. This includes telling the beneficiary that Medicare is running out of money, so the beneficiary better get his or her wheelchair now, even though it's not needed at this time. Getting equipment now for possible future needs does not adhere to the Medicare rules and is therefore illegal. It just says you don't need to stockpile durable medical goods, guys, or durable medical equipment. It's not necessary. Imagine if you did that. There's innovation happening all the time. Wheelchairs from 5 years ago look nothing like the wheelchairs that we have today. Stockpiling something for future use could be detrimental. Do not let anyone talk to you into stockpiling equipment. All right. If you need the equipment, it should only be ordered through your regular family physician. If someone calls and tries to threaten or pressure you into something, simply hang up the phone. Be aware that you are responsible for 20% of the final amount, including potentially unnecessary add-ons and accessories for the device ordered. Frequently, the scammers do not explain this. For those of you that are that have TRICARE Prime for Life, which has very low copay, those of you that are on Medicaid are called dual beneficiaries, meaning you have Medicaid and Medicare, you may not pay a copay for some of this equipment because Medicaid picks it up, or your TRICARE Prime for Life if you're a military retiree, or if you have a great supplement from one of your companies that you work for and earn that supplement, you may not pay huge copays, so it doesn't seem like a lot. But anytime someone is offering you something for free and upgrading the product, just because you don't pay a huge copay doesn't mean it won't impact you going forward. All right, next slide, please. What can you do to stop DME fraud? All right, here are a few tips or things you can do to stop DME fraud. The best way to avoid becoming a victim of DME fraud and scams is to protect your personal information. You should never give out your Medicare number to a stranger, in person, or over the phone. Treat your Medicare card like you would a credit card. All right, refuse and report anyone offering free equipment, supplies, or services in exchange for your Medicare number. Guys, I want to add to that. If they say they represent Medicare, if they say that this piece of equipment was approved by, was tested by, or any other type of terminology that puts Medicare's word behind it, it's a big red flag. If you do make the mistake of giving out your information, reviewing your Medicare summary notice or explanation of benefits is the best way to make certain that no one is using your Medicare number to commit fraud. If you're on original Medicare, you should receive an MSN once each quarter. If you're on Medicare Advantage plan, you should receive an EOB or explanation of benefits after you receive healthcare services. Guys, once again, for those of you that are on TRICARE Prime for Life, for those of you that are on Medicaid with your Medicare or dual beneficiary, it's really important that you look at these. Even though you're not paying large copays, you want to make sure that someone is not using your number for fraudulent activity. If you see any suspicious items on your MSN or EOB, you must report it. It is very important that you care about what is going on with your Medicare benefits. If Medicare pays for equipment that you never ordered or never received, when you need the equipment, Medicare will deny it because it will show that you've already received it. And guys, I don't know about you, but if I needed a knee brace, and a lot of us will need knee braces and back braces, I would rather have a custom fit knee brace from orthopedic doctor in my neighborhood or close to my home prescribed to me from my general practitioner rather than one shipped to me from a warehouse with someone that never even saw me. And a lot of times, guys, the orthopedic doctors will give you a great knee brace that they'll even say, come on in, make a quick appointment. They even have drop-ins here in Metro Atlanta where you can drop in and get adjustments. You don't even need to make an appointment, and they'll adjust your braces for you. So be aware of that. That's the kind of care and service you want. To avoid becoming a victim of DME fraud, you should follow Senior Medicare Patrol's message, which is to prevent, detect, and report. Now, Danielle's going to get into that a little bit more, and I guess we'll be open for questions later on. But thanks a lot, Sunny. I think that's it. Next.
Thank you, Jose. So now that you've learned more about durable medical equipment fraud and scams, Danielle's going to talk about our 3 keys to success in stopping healthcare fraud, waste, and abuse. And as Jose said, it's prevent, detect, and report. Danielle?
This will go much quicker if I actually take my microphone off of mute, won't it? Good morning, everybody. So the first thing that I want to talk to y'all about, and the first key to being able to save your Medicare dollars from fraud, is to prevent. That is, protecting your personal information is your best defense against healthcare fraud and abuse. Treat your Medicare and Social Security numbers like your credit cards. You never want to give these numbers to a stranger. Remember, Medicare will never call you and they will never ask for your Medicare number. Don't carry your Medicare card in your wallet or purse unless you need it for a doctor's appointment. And then keep a record of all your medical visits, tests, and procedures in a healthcare journal or on a calendar. Next, please. The second key is to detect. Knowing how to spot suspicious activity can help you stop healthcare fraud and abuse in its tracks. Review your Medicare summary notice, also known as an MSN, or an explanation of benefits, are also called an EOB. The difference in those two is that an MSN is when you have red, white, and blue Medicare that comes directly from the Medicare part of the government, or if you have an explanation of benefits, an EOB, that's where you have a Medicare Advantage plan. You want to look at your Medicare summary notice, which is going to be mailed to you every 3 months. Or if you have a Medicare Advantage plan, that's going to come anytime you receive healthcare services. So with the EOB, it's going to come after you've been to a doctor. If that's 3 times a month, it'll come 3 times. If you have Medicare, the red, white, and blue card, that's going to come once every 3 months, no matter how many times you go to the doctor during that period. And then you want to look at your statements against your personal records. So you're going to look to see, were you charged for something you didn't get? So you went to see your doctor and he just did a checkup and sent you home, but you got charged for a lab or you got charged for an x-ray. You need to question that. Billing for the same services or supplies twice, or services that weren't ordered by your doctor. Again, something like a lab or an x-ray that's on your Medicare summary notice or your EOB, but you know you didn't have those done. Next. So the third and final key is to report it. And if you suspect you've been a target of fraud, report it. This will help you and others at risk to be, so the government is aware of any healthcare scams. Here are some of the steps to report suspicious behavior. If you receive a suspicious call, don't give out your personal information and report that call to Senior Medicare Patrol. If you have questions about your Medicare statements, call your healthcare provider or plan. But if you're not comfortable in calling them, call us, call Senior Medicare Patrol. And we will help you with that. That is what we are here for. We are a resource for our Medicare beneficiaries. And you see our number up there, 877-272-8720. Next. And here is the way that you can also help your community. You might be wondering how you can help and become involved. Senior Medicare Patrol is always looking for civic-minded individuals to join our fight against Medicare fraud. The benefits of volunteering for our program include gaining the satisfaction of participating in a national effort to empower members of your own community to prevent, detect, and report healthcare fraud, errors, and abuse. Our volunteers receive training on the basics of Medicare and healthcare errors, fraud, and abuse, and scams. In addition to giving presentations and attending community events, our volunteers participate in bi-monthly webinars and various training opportunities throughout the year. And we also host a volunteer appreciation event in April for National Volunteer Week. Volunteering for the SMP program is extremely flexible and is done on an as-needed basis. Volunteers are offered opportunities and have the option to decline if they are not available. They determine how often they'd like to participate. And we also want to mention that this is a great volunteering opportunity for couples. In the past, we've had couples team up to volunteer, give presentations, and attend community events. If you think volunteering for SMP is something you might be interested in, give us a call at our toll-free number, 877-272-8720. We would be more than happy to send you one of our volunteer information packets and answer any questions you might have about the process. Next. As mentioned in the previous slides, we have a toll-free number, 877-272-8720, or you can visit our website at www.stopmedicarefraud.org and for additional information about our program. Additionally, we would like to encourage you to scan the QR code on the screen using your camera on your cell phone, and that will guide you to our social media platforms, including our Facebook, which are in Georgia, Louisiana, Mississippi, and our Spanish Facebook pages. You can go to our YouTube channel or listen to our podcast called Sip and Learn with SMP on Spotify and Apple Podcasts. And that is my portion of the presentation. And now Sunny is going to take back over. And thank you all for being here today.
Thank you, Danielle, and thank you, Jose. So coming up next month for our webinar Wednesdays, our hot topic for the month of August is going to be pharmacy and prescription drug fraud. That webinar is scheduled for Wednesday, August 30th at 10:30 a.m. Central Time. So we hope you'll join us then. Just be on the lookout for an invitation to register later next month. All right, so now it is time for our prize drawing. So everyone that registered prior to 10:15 a.m. this morning, so you had to be registered before 10:15 to be entered in for a chance to win, and you have to be present as well. So the winner is going to receive their choice of a $25 Walmart or Amazon e-gift card. And let's see, all of those names have been entered onto our wheel. So here it is, and we're going to go ahead and give it a spin and hopefully have a winner. All right, it looks like Miss Dora Thomas is our winner today. So congratulations, Miss Dora. Dora, I will reach out to you later this afternoon and get the information so we can get you that gift card. All right. Sorry about that. All right, so before we wrap up today's presentation, I did want to open it up for question and answer. If you have a question regarding any of the information that we presented today, you can raise your hand and we'll unmute your line and you can ask it. Or if you would prefer, you can send us a message in the chat. Let's see. And the little hand button, if you can see it on the picture on your screen, you should have a little go to control panel and there's a hand. If you click on it, it's going to raise it. Or like I said, you can send us a message through the chat if you'd prefer. All right, well, I'm not seeing any messages, so if you have any questions, you can always reach out to us later. This will conclude our presentation on durable medical equipment fraud and scams. Thank you to our presenters for today, Jose and Danielle. You will receive an email later today with a link to a short survey. I also included it in the chat earlier, but we would really appreciate it if you would take a few moments to complete the survey and let the Administration for Community Living know how we did today with our presentation on durable medical equipment. We appreciate you joining and we hope to see you again soon. Thank you and take care, everyone.